Covering the stories that impact your life, your town, your state, and your future. This is the Means Report with your host, Brad Means.
Hello, everybody, and welcome once again to the Means Report. We certainly appreciate you spending part of your day with us, where if you have watched the Means Report for any length of time over these past 27 years or so, then you know that October is a big month. And we're recording this in late September, but October is almost upon us, and with it, a huge focus on cancer, breast cancer, overall cancer. We're going to cover that today and put that dreadful disease in the spotlight, because there are so many resources right here at home to help those who are in that fight. We'll start with the spotlight on breast cancer, and then we'll move on to a huge event that's now truly just days away. PACE Day is coming up quickly, and we'll tell you about how you can take part in that, have fun while you raise money for cancer, and support the great work and research being done right here at the Georgia Cancer Center. And we'll wrap up the Means Report, as always, with ways that you can stay in touch with us and help us get more great guests, like a man who is really on a short list of those who need no introduction. He's Dr. Randy Cooper, a huge part of our community and a huge advocate for women's health. Dr. Cooper, thank you for what you do for your patients and just for the CSRA, period.
Well, we thank you guys for what you do and help us.
Well, it's our pleasure to do that. Dr. Cooper, I know your specialty is surgical oncology and breast surgery. I know that the Breast Health Services unit, if you will, at Piedmont is named for you. So let's talk about that Breast Health Services department, as well as the mobile mammography unit. What goes on there? Is it where a woman goes after she is diagnosed with breast cancer, or do you all do other things there as well?
It's actually both. If somebody finds a breast lump, or they have an abnormal mammogram today, they don't have a doctor. They call our breast center. Somebody will see them today. They will get a biopsy today if they need one. If they need additional mammograms or ultrasounds, we'll arrange that. But if we make a diagnosis of breast cancer, of course, that is where we send all of our patients to for education. We've got at least 2, sometimes 3 navigators. We've got 2 geneticists. We've got a boutique, which I call the look good, feel good place, because in the boutique, they provide hair pieces, they provide turbans, hats, gowns, swimsuits, jewelry, just about anything you need if you're going through chemotherapy or breast cancer. But our big emphasis is education for the patient, for their family, their husbands, their children, and try to take them through this walk.
Well, you just answered my next 10 questions, but I want to dive into the team approach a little bit more. It's not just Dr. Randy Cooper holding a woman's hand through this process. Y'all have a whole team, as you said, ready to get the woman and her loved ones through it.
That's correct. And everybody who gets diagnosed with breast cancer, we have a meeting every Tuesday morning at 7 o'clock, which has got pathologists, radiologists, medical oncologists, surgical oncologists, geneticists, navigators. We all come together. We review their mammograms, review their pathology. We discuss the patient's health, what their needs are, and then we come up with a plan for that patient. A whole team. It's not one guy.
Dr. Cooper, the things that you've described so far seem like it's all about efficiency. When I think sometimes of going to a doctor's office, I think about a long wait, a delay. But with breast cancer, from the moment a woman may notice that lump or something unusual, y'all move pretty quickly, right?
We try to. It's not a life and death emergency, but mentally it is.
It is.
And so once we know somebody's got a diagnosis, we immediately try to get them in, get the process to moving. I had a patient not too long ago fire me because she said I was moving too fast.
Are you serious?
And I sent her to another doctor. She came back and fired him and said he was too slow. So I wasn't sure exactly what she was looking for. But we move as fast as you want to move.
Well, I'm glad she came back to you. She came back to the best. I promise we're going to talk about the Miracle Mile Walk. But first, tell me about the mobile mammography unit. I remember broadcasting on Channel 6 when that thing first came about. Is it like an old worn down bus at this point?
No, we're getting ready to, it's coming on the 18th. We're going to have our 3rd mobile mammography unit that the patients and the community can see. That actually started back in about 2001 and 2, a lady named Queenie Jones.
Yeah.
She was just instrumental. We didn't start out raising money for free mammograms. We started out raising money to buy the mobile mammogram units because she realized a lot of people didn't have money to get a mammogram. She realized they worked in companies or factories where they couldn't get time off. So we now send that mobile mammogram right up to your front door and do your mammogram. So that started in 2000, about 1 or 2. First rally they had, I think they had less than 200 people raise $2,000. And if I back us up to 2023, we raised $525,000 and probably had 14, 15,000 people there.
It's amazing. So whether it's 2,000 or 500,000, how significant is the Miracle Mile Walk when it comes to raising money for Piedmont and for breast cancer treatment overall? Is that where most of y'all's funding comes from?
Well, we get funding elsewhere too, but
Sure.
for the people who have no mammograms, people who are going through breast cancer, who may need, for some reason, a rent payment or some financial need, we try to raise money to help them meet all those needs.
What's it like for somebody to come in there who not only is having to deal with a diagnosis, but who, as you just mentioned, may not be able to pay their bills to stay in their home? Is there a point where you all say, hey, don't worry, we are going to shoulder that load for you? And what must that feel like for the patient?
All I can say is I told somebody just this morning, my great thrill in what I do is not operating in an operating room. I love that, but I like sitting down with somebody and them scared to death, sometimes crying, and go through about 45 minutes to an hour. And when you get through and you tell them what they've got, you're going to be a survivor. We're going to help you get that. We're going to find means for you. Whatever it takes to get there, we're going to find it. And when they walk out, they're laughing, they're joking. It's like you've turned a light on.
I bet it is. How do you take part of the Miracle Mile Walk? Do you just show up that morning and walk? What do you need to do beforehand? It's October 18th, so we have time.
They're going to start warming up at 8 o'clock.
Yeah.
And some talks and things. But if you want to be there for that, you ought to be there at 7:30 to register. The walk will actually start at 9 o'clock. Mm-hmm. And because the construction's on Broad Street, I think it's actually going to go up Reynolds to begin on Reynolds. But we're still going to be at Augusta Commons.
Can you walk by yourself, or do you have to be a part of a team?
You can walk any way you want to. You can walk on your feet or on your hands. We'll take all comers and we'll bring friends. And what we enjoy most is all the competition that goes on, like in the hospital, different floors trying to raise money.
Oh, yeah.
See who can get the biggest crowd there. So it's a fun day for us.
Is there strength and unity if you show up at the Miracle Mile Walk and you're surrounded by people going through the same thing? Does that help a patient?
Oh, there's no question about it. You know, that old saying, misery loves company. I mean, when people see all these people who are survivors, they begin to realize, hey, I'm going to do it too.
How about breast cancer treatment over the years? If you just go from your starting point in your career to now, is it better than it used to be? Can a woman get through it faster?
Well, I guess the word faster is there's certain things you got to do at a certain speed.
Right.
Just say if you're going through chemotherapy, there's no such thing as fast. It's going to take so many weeks or months. Radiation is a set period of time. But as far as getting your surgery done, we do have a little bit of control on that.
Dr. Cooper, I ask you this every time you're here, and I think the answer has changed over the years, at least a little bit. When should a woman start to get a mammogram? We always preach early detection for all types of cancer. What age should that woman start doing that?
There's a little controversy among some different organizations, but we feel pretty strongly that you ought to start at age 40 and get your mammogram every year. If you have a parent or a sister who had breast cancer, say early 40s, you should start your mammogram and probably ultrasound as well, at least 10 years before that.
If you have a relative who has had it, are you going to get it?
No, you do not. Your risk is increased though.
Yeah, the risk.
Especially if you have a first degree relative like a sister or a mother, and they were young and they had double mastectomies, that moves your risk up considerably. You need to be put in a high risk clinic follow-up situation.
Everything seems so separate these days when it comes to our religious beliefs and then how we operate in the private sector. Can faith play a huge part? And as a physician, are you comfortable introducing that component into your approach to treatment to say, look, let's pray for a minute. Let's help get God to get us through this? There's
no question. It's a big part of it. And when you pray with them, I'm here to tell you right now, you have moved them up to another level of, hope.
Yeah.
They want you. They want a guy to pray for them. They want the doctor to pray for them. And pray, cry for them, whatever it takes to let them know that God is on their side. This is bigger than us. It's something that requires, to me, the creator of the universe.
Let me ask you one more question, Dr. Cooper, and it's just a comment that you may be able to give to somebody who's watching who feels like they are in their darkest hour because they are just fresh off a diagnosis and they're wondering if they can beat breast cancer. and keep their family and their lives together. You've seen the outcomes every single day. What would you say to them?
Well, what we try to do is also get them in a support group at the hospital, women who've been through this, who they can sit down and say, hey, you're going to be fine.
Yeah.
I did it. Yours is worse than mine. You're going to be fine. And I think that's one big way we do it. But I think just sitting down and being honest with them, what they got, what you're going to do, lay it out, put it on a piece of paper for them, call them in a couple of days, check on them. I think those are the things that make a difference.
They make a huge difference, I'm sure, and they give those folks hope and optimism. Dr. Randy Cooper, thanks for everything you do and for once again coming to Channel 6 and being on the show.
Thank you, Brad, very much.
Absolutely. Dr. Randy Cooper, Piedmont. Take part in the Miracle Mile Walk. It's a beautiful way to start your day and to help Dr. Cooper's work continue along with his team. Speaking of teams, you can join several of them and take part in Pace Day, walking, riding, running. It matters not. It's all about raising money for the Georgia Cancer Center, and it gets bigger and better every year, except for last year with the hurricane, and we're going to make up for that in just a few short weeks. Stay with us on the Means Report.